Hi, I would like to welcome you all to the training program for the Informed Consent. My name is Tiffany Grimes. I'm a research nurse coordinator with the Center for Clinical and Translational Science and the Clinical Research Support Program. I hope that you find this information helpful today. I'm going to start off with a couple of examples of why the informed consent process is so important. The first is the case of Jesse Gelsinger. He was an 18-year-old young man who died from participating in a study. He had a rare liver disorder, and upon investigation of his death, several things were found wrong, to be wrong. The first is PI financial conflict of interest. The PI, they also enrolled some ineligible participants. They failed to disclose some potential risks to participants. They violated protocol stopping rules and submitted misleading and inaccurate safety reports. There's also the case of Ellen Roche. She was a healthy volunteer who participated in an asthma study who died from complications of that study. During further investigation, they found that the consent failed to disclose that the medication being used was experimental and not FDA approved, and that it could be toxic to your lungs. They failed to report unexpected adverse events, and they failed to file an IND. So the objectives of today's talk are to differentiate between the consent process and the consent document, to identify the basic elements of informed consent, discuss hindrances of informed consent, identify opportunities to improve informed consent, and to discuss methods to evaluate informed consent. A meaningful informed consent discussion is a conversation. It's an ongoing process that keeps the participants informed and continues until study completion. A couple of places for additional information about informed consent include ICH Guidelines 4.8. Another point of reference will be the Federal Code of Regulations, 21 CFR 50 Part 20, and CFR 45 Section 46.116. Now we're going to talk about the consent document itself. In 2002, a survey of 1,600 respondents performed by CenterWatch found that 14% of participants did not read the consent before signing it. So this goes to show another reason why it's not just handing them a consent document, it's also going over it and making it a part of a conversation, and why that's so important. The consent document should be used as a teaching tool, a guide. It also shows signed receipt by the study staff and by the investigator and by the participant. It's also a resource document for study participants to refer back to throughout study participation. The definition of informed consent is a decision to participate in research made by a competent individual who has received the necessary information and, after consideration, has arrived at a decision without having been subject to coercion, undue influence, inducement, or intimidation. So there's 4 basic elements of informed consent. The first is the participant's capacity to consent, disclosure of relevant information, participants' comprehension of the information, and voluntary decision to participate and withdraw. So some hindrances to the informed consent is confusion and forgetfulness. This can be due to an illness, and anxiety and fear and depression, or it can be due to an impaired thought process. Another hindrance would be situational pressure. The patients, a lot of times subjects have been given a new diagnosis. There's limited time for making a decision, and they want to make sure that they're making the socially acceptable response, and all of those kind of things need to be taken out of the situation. Third would be therapeutic misconception. Participants believe that research protocols can be designed to benefit them directly rather than to test or compare treatment methods. This is also, therapeutic misconception is also compounded by the lack of distinction between the role of the physician and the researcher. Time constraints. That's on the part of the coordinators and investigators because they have multiple responsibilities and are often have multiple studies. Clinic time is valuable, so they have to squeeze in as much as they can in a short period of time, which sometimes leaves limited opportunity for questions and answers. No matter how time constrained you may feel, hope your patients and your subjects that are considering participation in studies should never be able to detect that that pressure or lack of time. Readability and increasing regulations also make the informed consent process more difficult. The length of the consent documents. In 2004, Sharp found that the average consent document contained more than 2,700 words. It would take an average high school graduate 12 to 14 minutes to read the consent document. We all know that some consent forms are probably shorter than that, and some consent forms can be much longer. So we need to make sure that our patients have optimal time to review all aspects of the consent form. There's also some cultural barriers that could cause a hindrance, sometimes a lack of trust between healthcare professionals or a lack of understanding of what's being asked of them. So, of course, if there's hindrances to the consent process, there's also opportunities to improve the informed consent. So we have to make sure that the improvements can come with the timing of the explanation, the readability of the consent form itself, clarifying and any misconceptions about therapeutic misconception, and pay particular attention to individuals at potential risk, and availability. So timing of explanation. You need, a lot of times, if you can imagine, some patients for some of these disease processes that are being studied are life-changing. You have to make sure that they have time to adjust to their new diagnosis, time to digest what is happening in their life and what is going to be going on. To us, a lot of us as healthcare providers and in the healthcare profession, we kind of take that for granted. So we need to make sure and understand that this anxiety and this reality for these patients is important, and they need this time to adjust to these things. We need to make sure that there's plenty of time to explain the study to the participants. We need to give them the 24-hour waiting period if that is at all possible. And we also need to revisit the consent document on a regular basis. If they agree to participate in your study, you owe them the opportunity and the courtesy to answer any questions that need to be answered at any time. The readability of the consent should be on an 8th grade level. Suggestions to make the informed consent document more reader-friendly. So there's some language considerations, just as changing 3-syllable words to 2-syllable words. Break all compound sentences into 2 short sentences, and limit the line length to 30 to 50 characters. Take out and use everyday words such as teaspoons instead of milliliters. and instead of you'll be at risk for infection instead of leukopenia due to myelosuppression. Use an active voice in sentences. Change a sample will be drawn to we will take a sample. And avoid abbreviations and acronyms. And make sure that you use consistent terms throughout the consent document. Examples, benefits when there are none. The research physician treats all subjects under a specific protocol to obtain generalizable knowledge and on the premise that you may or may not benefit from your participation in the study. This is on a college level. There may be no direct benefit to me. However, information from this study may benefit other patients with similar medical problems in the future. So it's a little better, but still not quite to that reading level that we want because it's on a 12th grade reading level. Next will be, there is no benefit to you from being in this study. Taking part in this study may help patients in the future. And that is on a 4th grade reading level. So that's closer to where we need to be, or somewhere in between. So organization of the document. List procedures in chronological order so that patients kind of can easily refer back to it when they're wanting to know what's coming up for their next study visits. When describing risk and side effects, group them in categories from most likely, less likely, and unlikely. The layout and design. Use large block text and use white space so that you don't get overwhelmed. I can think of several times where that the use of white space would have been more beneficial when you're trying to gather information and when you're trying to understand something. So if you're feeling overwhelmed, it kind of forces them to take a break and digest what they've just read. Do not justify right margins. Use at least a 12-point font and use titles and subtitles to clarify and organize the text. To minimize therapeutic misconception, when discussing alternatives, distinguish between medical treatment and research. Explain the difference between relationship of the doctor-patient and investigator-participant. State clearly and repeat often the purpose of the study. Do not over-enunciate the benefits of the study, and avoid terms such as treatment, therapy, and patient. Being in a research study is different from being a patient. When you are a patient, you and your doctor have a great deal of freedom in making decisions about your health care. When you are a research participant, the individual and the doctor, principal investigator, and research staff will follow rules of the research study as closely as possible without compromising your health. It's also important to remember that patient safety is always our #1 concern as research coordinators, so we have to bear that in mind. Pay particular attention to individuals at potential risk, such as low income and low literacy groups. So what is health literacy? The degree to which individuals have the capacity to understand, process, and understand basic information and services needed to make appropriate decisions regarding their health. So this is just a chart that shows how it breaks down patients who have a below basic and a basic understanding of their health information. This is just an example of how we can sometimes still read things even if it isn't exactly right. Offer to read your consent form document to all research subjects. You don't have to make reference to their reading ability. For example, the researcher could say, Let's read this document together, or if you would like, I can read the document along with you to make sure we go over all of the information is clear. The elderly is a special population to take into consideration. They may experience disease or live in situations that impact their ability to freely protect their rights. They may have greater difficulty differentiating the role between physician and researcher. Language barriers. And a U.S. Census revealed in 2005 that 19.4% of the population spoke a language other than English at home. For the consent process, the consent should be in a language understandable to the participant that is IRB approved. It's helpful if you're going to consent in a different language other than English that you have a coordinator and research staff that is fluent, or a translator handy that is fluent in the language of the participant. Vulnerable and protected populations include children, prisoners, women, and fetuses. Availability. As research nurses and coordinators, a lot of times we should make sure that our patients know how to get in touch with us if they have questions, and know that they will get a response back from us in a reasonable amount of time. So, evaluation of the informed consent. There's some tools that you can use and some question answers. So some example of question answering session to kind of document and make sure that the subject understands the consent document. You can say, I want to make sure we have the same understanding of this research. It's my job to explain things to you clearly. I want to make sure I did this. I would like to hear your understanding of the research project. So human research is a privilege and it's not a right. So it's our place to make sure that we keep our patients safe. Informed consent is a legal and moral responsibility to uphold the individual autonomy and personal dignity of all people who consider participating in research. That also just reiterates the fact that our patient safety should be our #1 concern. I would like to conclude with a couple of videos about the informed consent process, and I would like to thank you all for your time. Have a great day.